Hi, today is St. Patrick's Day and it's 2022, so it's March 17th. And unfortunately, the Ukraine is still under attack by the Russians. And this has been a little bit troublesome for a lot of people here in the US as well, because there are many military people and medical people, and there's families that are from the Ukraine or from areas in Europe that are being affected by this, and our gas prices and the oil industry and everything. So in order to stay calm, we want to be mindful where we are. So I'm wishing you some peace today and some Irish wishes, and hoping that you can enjoy just our time together. I do want to mention that my focus tonight is on the gallbladder. And this was a topic that I wanted to address because several people I recently had interacted with had their gallbladders removed. And that was similarly what I also did. And sometimes when we're headed in these directions and we only see one way to go because we're pointed in that direction, it sometimes can be a little confusing. I always say everybody makes a choice and it's their choice, but if it were anything that I could do to prevent anyone from going down the path of removing their gallbladder, I would hope that this talk would talk you out of it. So, there are a lot of things you can do to cleanse your system, cleanse the digestive system in your body, just to get things moving a little bit more effectively and functionally. So, but tonight we're going to talk a little bit about gallbladder disease and what brings us to that point. We think that, a slow gallbladder or a non-functioning one or gallstones means that, we are all messed up and this gallbladder's just got to go, because that's where I was. I really just only thought as a nurse that, once you get to this point, then you have to have that done. And then once you get to that point, you have to have that done, because that's what was going on around me. So today we're going to talk about what you can do to prevent yourself from having surgery if it's not really necessary. Now, if there's huge tumors that are blocking ducts and things like that, I am not going to give you advice about that. That is your decision. But what I can tell you is there are ways to reduce tumors. There are ways to make things more functional for them to work. And today I'm going to share with you information from a Dr. Gerard Mullin, who is an Institute of Functional Medicine doctor who is part of our faculty for Functional Medicine Coaching Academy. I will share both of those, the Institute of Functional Medicine below in the comments, and I also will share Functional Medicine Coaching Academy, who's run by Sandy Scheinbaum and Elise Wagner. That's the program that I went through, and I'm very appreciative because I love their faculty. The people that they had on their faculty had a wealth of information. So real quick, I'm going to share my screen, and I'm just going to introduce you to the gentleman that put together the information that I want to share. I can't show you all of the webinar. I can show you bits and pieces because this is his information and it's from Functional Medicine Coaching Academy. So I'll share the information that was personal to me, that made sense, and some of what he did, bits and pieces of what he shared. So he is an MD. He's the co-director of JHH Nurse Practitioner Fellowship Program. His expertise is clinical gastroenterology, inflammatory bowel disease, which is a lot of what we're seeing today, integrative medicine, malabsorption, neurogastroenterology, nutrition, and weight loss. So his research interests are elimination diets in gastrointestinal disease and how those work. Nutrition, gut microbiome, probiotics, integrative medicine, celiac disease, spectrum of gluten intolerance. When you think of spectrum disorders, a lot of people are talking about autism. It might be that you are having gluten intolerances, and there might be some other toxicities that you're dealing with that are causing these gluten intolerances. Inflammatory bowel disease, small intestinal bacterial overgrowth is a big topic in functional medicine, which is called SIBO, S-I-B-O. And gastroesophageal reflux, I've experienced that well into many years of my life. That also is associated to indigestion and GERD, which that is gastroesophageal reflux disease, and also gastritis, chronic gastritis. When you have these things occur for such a long period of time in your life, they can turn into cancers. And it's all about correcting what's going on, what you're putting in your mouth, and we'll go into that. So now real quick, we're going to go over share some of his webinar. Now, we talked about who he is. He, like I said, this is from Functional Medicine Coaching Academy, and they did provide a transcript for the webinar, but we're going to just look at some slides really quickly. Digestion Basics. So critical factors, important for proper digestion and absorption, components of some model he calls dig-in, explain malabsorption and maldigestion, and describe the factors that may contribute to a sick gut. So, he's done a very good, this is one, a very excellent webinar. But like I said, this is material that we learned as functional medicine health coaches that can help us understand you. And if you look at the bottom part of this, the modifiable personal lifestyle factors, these are my 5 points of awareness. There's sleep and relaxation, nutrition, or the pancreas, I always say, this is fingers for that. Exercise and movement, I have as a pinky finger. Stress, I have actually as sleep. That's this finger. And then relationships is our ring finger. Okay. So I sort of made it into my own way of looking at things for me to better tolerate or understand how I can deal with it. And it's a tool for you maybe too that would work for you. And so this is my book, and I have, connected these to the hand, and we'll talk about that later, or you may have already heard that concept. So you talk about healthy guts and how they work. It's how we eat, taking our time to eat, which is mindful eating, and using the digestive juices that we have in our body that are supposed to be working, and then making sure that our intestine is working properly. The balance of the ecology, which is the microbiome, which are all the different types of microbes in our gut, and whether or not they're balanced, or maybe there's something that's way out of balance. And then our nervous system, because our autonomic nervous system. So there's stress factors related to fear. And if you've been in chronic conditions where you're chronically stressed by anything, which could be food, or it could be an environment, could be some emotional event, or something in a relationship that's causing chronic stress for you, or maybe your living conditions, wherever you are. So a sick gut would be poor diet, problems with dehydration, interaction with medications, because some of the medications we're taking cause, other issues in relationship to the poor foods you're eating. And then infections evolve from different problems with the immune system. The immune system can't properly function if it's not fed properly. And then it gets hypersensitive. And so it'll respond to just about, and that's where allergies and you might be having some kind of sensitivity to a food. And then before you know it, it's turning into a full-blown anaphylactic reaction. I've dealt that with family members and they've had really bad issues, interactions with medications, we mentioned, infections, toxins, the metals that are around us. Sometimes it's in our waters, sometimes it's in what we're cooking with that leaks into the food. They know that there's toxic problems with some of the non-stick cookware. We mentioned that before in one of my other talks. And there's iron, aluminum, copper, zinc usually is not as much of a problem, but there might be some other imbalance that's causing a zinc imbalance. Maybe you're low in zinc. And then there's iron, which can be from a lot of foods not properly being digested, or it could be from cast iron cookware. You have to really think about everything that is around you. Lead in the water, lead in the pipes, or what you're dealing with. Copper pipes could be causing problems too. And copper also is in some of the items that women use for, there's all kinds of different things that you might find these metals in. I'm just mentioning it. Also in your teeth, when they did the fillings, there's issues with lead, other problems with heavy metals. Okay, now, when you don't have enough digestive enzymes in your stomach acids not working up to par, that can be connected to something called EPI, Endocrine Pancreatic Insufficiency. And that would prevent you from digesting your food. So if your pancreas is tired and fatigued, then you may not be able to produce the digestive enzymes that you need, because maybe years and years of eating too many sugars just wiped it out. And that can happen at the age of 20, it can happen at the age of 10. It just depends on each person and what they're eating. Imbalanced ecology, that could be either in the gut or around you. Impaired intestinal permeability, that's what I talked about. When there's big leaks in the intestines, it's supposed to be like this movement, there's pulsations so the food can go through and the blood vessels are working and it's trying to get the nutrients and get rid of the things that it doesn't need. That's what that whole intestine's for, just to get rid of the toxic waste. But when your intestinal lining is not working, and then these leaks open up and the food actually goes through, and it turns into going into your bloodstream, backing up into your system, and then the body recognizes these as threats, and then it starts becoming super hypersensitive. And that is another problem with that's leaky gut. They've also connected leaky brain. That can happen to the brain because things aren't working up to par and things are leaking, and so things are crossing that shouldn't cross into the brain barrier, the blood-brain barrier. And then we go to the neuroendocrine balance and autonomic function. Neuroendocrine, I want you to think about the nervous system in relation to the endocrine system, which is all the glands, and that's your pineal gland, your hypothyroid, your thyroid, your parathyroids. Then there's other glands in your head, the thymus. Then you've got the pancreas as a gland, and then you've got the testes, and for the women it's the ovaries. But there's multiple hypothalamus and other things that are missing in the brain. But what I'm saying is these are connected because these neurotransmitters are connecting all the glands to the nervous system, and they talk to each other all the time. So what you eat, because your pancreas is here, it just starts talking to all these other areas of the system. Now, my puppy dog is here. His name is Baxter, and he likes to be around me when I talk. So you're trying to find out what the root causes of things. And we talked about digestion and absorption, intestinal permeability, gastrointestinal flora, which is the microbiome, what microbes are in there populated, what the good population is for you, immune regulation and inflammation. Are you hypersensitive to things for different reasons? And enteric nervous system. That enteric nervous system, of course, is the parasympathetic and the sympathetic, whether you're balanced or if you're one-sided and you're on a huge alert. Everything is an alert for you, your body, your whole body. Sometimes you get scared because somebody just walked into the room and you almost flip out. I mean, those are hyper alert states, and that can occur from trauma or PTSD, whatever it is. Okay, so he's got dig in as part of his model. Mine is 5 points of awareness. Now, enzymes and other digestive secretions, believe it or not, everything starts right in the mouth. So your salivary glands are starting to act when you eat to break down foods. Then there's the HCl in the stomach and pepsin. Then there's the pancreatic enzymes. And then there's the bile acids. They come from the liver to help break down the fat. Pancreatic enzymes are mostly for proteins and all the other foods. Lactose, part of milk. Intestinal brush border enzymes, lactase. We talk about that because so many people are lactose intolerant, and they have connected that to both diabetes and to it's connected to celiac disease, and then there are some other genetic factors that they have found really down the road that said that there's these certain bodies are unable to break this lactase down, or lactose. That's what lactase is. Cholecystokinin is something that breaks down fats that comes from the gallbladder and the liver. So those things, if they're not working, guess what? You're going to have all kinds of problems. You'll have trouble when you go to extreme altitudes, when you travel. You'll have psychological, emotional stress. You have the food allergies and the sensitivities. Your bile is not secreting like it should, so you can't break down the fats, and then you start having pain. Sometimes you're having a ton of problems with your gallbladder not functioning properly. And that is what tonight's topic is, gallbladder disease. So real quick, and plus your HCl won't be working, which is supposed to help break down your foods. Now, if it's not working to break down your foods, and then you go and take an over-the-counter HCl blocker, then you're totally working against the whole digestive system in itself. I'm going to use this. This is a little baster for, turkey baster or whatever you want to use it for. But this is like the gallbladder. And I'm going to just pretend that this is one of the ducts from the liver. And all the fluid comes in here, sits in the gallbladder, and then it squirts out a little area into the small intestine or duodenum. It's either the jejunum or the duodenum. And it goes directly into the intestinal to break down the fats. Okay, so then on the other side of here would be another part that would come from the pancreas and the pancreatic enzymes. Those are the exocrine pancreatic, and that's the EPI that I talked about. But this is from the liver. Okay, so the bile salts and acids in the bile comes down, and it's supposed to squirt really effectively when you need it to break down those fats. So some of the things that can happen are that this becomes dysfunctional. It slows up. Maybe your stomach's already having problems. It's not functioning the way it should with the food. It's starting to slow up, and that's called gastroparesis. Okay, so that's going slow. Then you got this guy going slow, and it's not working. And then all of a sudden it starts filling up with these little rocks and stones, and then you have gallstones. And then when you eat something fat, one of those gallstones gets stuck and it can't get the bile out, or it squirts out a stone. And then you have a sphincter of Oddi reaction. And that spasm can be so intense, and it can cause a lot of problems. Then you go to the ER, they don't know what's wrong with you. You might have just passed a gallstone, or you have one trapped, or you have multiple stones trapped. Sometimes there's stones trapped in your pancreas, in your ducts of your pancreas, or in your liver. So these things can happen when everything starts slowing down because it's not being fed the proper food. Okay. So if things start slowing down and you start having gallbladder issues, it might be because from a long time ago, you've been eating all the wrong foods. Now, all of a sudden, and like me, I took that gallbladder right out. So now you're somebody who's got a duct, and it's asking the liver to please. It's either leaking liver enzymes or liver bile salts, or it's not working, or you're asking on demand. I need you, liver. I need you. Punching that liver. Give me something when you're eating the fat. Okay. Now, if you're eating the sugar and there's nothing, that your pancreas isn't working, then they're both screaming at you, and you've got a lot of pain, and you're just so uncomfortable, you don't know what to do. So that's why, and these extreme scenarios can occur when your organs are just worn out. Your digestive organs have said, you know what, I've had it with you. I don't know what you want more from me, So these are what happens. So, we're talking about eating and about the hydrochloric acid in the stomach, and the enzymes and the bile and the enzymes. And then things start swelling up inside, and you can get so swollen in your intestine that it can just seal right off. And if you're not eating on a regular schedule, it will just twist. And then you've got a blocked bowel. And then you have to go rush to the emergency room. There are ways to reduce that chance. You don't want to go there. I was near that place. I don't ever want to go back. Okay, so I'm not going to go through everything, but here's some things with maldigestion. You get floating stools because your fat's not being broken down. That's what steatorrhea is. Then you have abdominal pain. You've got bloating and a lot of gas. And then your nutrients aren't being absorbed. You have edema, which I've dealt with this, hypoalbuminemia, which means there's not enough albumin in your circulatory system, in your blood vessels and in your blood. So it turns, all the water leaks out, and it leaks out all over you, and you get swollen. I had patients that we dealt with. They were almost bedridden because of their edema. And you could make a dent with your finger right into their leg. Sometimes men's testicles were so enlarged and so filled with fluid that they couldn't even find where to even put the catheter in. I mean, it was just, the body really needs you to take care of it. And these things can really get out of hand if it's not taken care of properly. So, and then bleeding tendencies, that all originates in the liver. And if your liver is inflamed or having issues, and sometimes viruses can take over that liver, of all the different hepatitis B, A, B, C, whatever. But if you're eating nutritionally sound and make these things all work together, they need to work in sync. If they aren't, then you can have bleeding tendencies. Alcohol is a huge problem with bleeding. If you're drinking, or you did drink in the past, you still may have some issues. Getting that adjusted takes a time for it to be on track. Weight loss, if things aren't, you can lose so much weight. I lost 60 pounds in 4 months, and I was in horrific pain and thought I was dying. So, I had pancreatitis and some hepatitis, and it was just a major disaster. So you really don't ever want to go back to that place when you think about it. Do I want to get back to where I was, or do I want to keep moving forward? What are you willing to do to keep moving forward so you don't end up back where you were? Okay, so getting to that gallbladder state of gallbladder disease, you don't want it to be diseased. You want it to be ease. You want the gallbladder to work with ease. Okay, so it can cause weight loss, growth failure in children. This can happen, you know, if you're pregnant and you're having children. This can lead to some other additional issues with your children, and you'll need to keep up with their nutritional status to make sure that they're getting the fats and the proteins and all the colored vegetables and fruits that they can to keep things moving in the way that it should, as again, with ease. You want it functional, and you want it to function with ease. So even with inside your mouth, your gums, gum disease, this is all a part of digestion. Dysbiosis is in the gut. And so that's another part of, you know, what am I doing to myself? What if I attracted to? I'm attracted to pie. I love apple pie. Okay, what are these things doing to me? I love cookies. What is it doing to me? Chips, French fries, you know, all this stuff that we just become so attached to. Bread. Oh my gosh, I used to love bread. I would eat bread with marshmallow and peanut butter. Okay, I want to get on because I want to show you what I made that can help you. And then we talked about the pancreatic enzyme deficiencies and the bile salt deficiency. I take this because I do not have a gallbladder, and it is ox bile. And I've had to bump this up because there are days when I still have these emotional eating patterns where I eat a little bit more chocolate or nuts. I'm very strict with my diet to eat healthy, but there are sometimes I still go backwards with some of my, okay, I'm going to have a little bit more than I should. And then I can sense that it just wears you down a little. It causes fatigue. So bile salt deficiency, that was, if your gallbladder's gone, you're going to have more trouble because you're asking the liver, excuse me, help me. I don't, the gallbladder's gone and I need you right now, Mr. Liver. Okay, now, pancreatic enzymes. Now, you can be, Creon is usually what is ordered, but everybody may need a different amount. So depending on where you are with your stage of disease, I needed initially, I was taking 2 with every meal, and that was adequate to start me off. Then later on, I found that there were some days I didn't need 2 with every meal. I needed 1, or maybe I needed more depending on what I was eating. So you really have to pay attention because it's got a lot of different ingredients which are supposed to be replacing what your pancreas is actually supposed to be offering. And if your pancreas isn't working, or you're overdoing it with too much even fruit, I mean, but most of the processed food that we have out there has just, I'm going to say that 80% of the people that are aged between 20 and 40 are already dealing with exocrine pancreatic insufficiency and some form of diabetes because their insulin levels, they're having trouble, and they probably need an HbA1c. Okay, so that is maldigestion. Let me see if I can go through he went through all this. Some of the things is chronic diarrhea. I had extreme constipation. I'd have it come and go with some diarrhea, but I believe I was detoxing some things. Undigested food and stool. Yes, if you can see what you're eating and you're not digesting your food. And iron deficiency, which is anemia. You can get intestinal infections. A lot of people are treated for C. diff. You know, things that are happening. Some signs of inflammation of the pancreas and the stomach are that as soon as you drink or eat something with sugar, you're filled up and you don't want any more. The body says, I can't offer you any more help with digestion. I can't, it's going to feel like you're filled. especially beer. A lot of people drink beer and then they don't have any appetite after that, or they'll just eat something salt, sweetie. That salt and sweet connection, boy, that's sodium and glucose. And that's in one of my other talks. Anyway, so anemia, edema, tetany, believe it or not, tetany, milk intolerance, bleeding, brushing them. I have to look into what he's talking about with brushing. I don't know if that's related to flushing. Iron, B12, folate, protein, calcium, magnesium. Calcium and magnesium are tied together. They work together, but in a ratio. And so if you're consuming a ton of calcium, you're going to have a low magnesium level. If you're over consuming calcium, you're going to have low magnesium, or you're going to be chasing, constant chasing. And then that calcium, what it does, it triggers all these things to happen in your parathyroids, your liver, and your bones. You can have terrible bone pain from actually eating too much calcium. And a lot of people who drink milk and chocolate milk and all these different things with dairy and ice cream, they can turn into terrible problems with debilitating bone loss. And you know, some of these, you'll see someone has bowed legs, or some that right there, you know, the vitamin C, it just ruins your immune system. And these things that occur, I have it on my LinkedIn profile, a talk about exactly how too much calcium and what it can do to your bone density. So, you know, you think that these things that were treated in the past with low vitamin C and things of a long time ago, they're still here. They're still here. We just didn't realize that they're here. So these are the suspects, the substances that are missing. Okay. Dysfunction is when your gastric pH and motility aren't working, your pancreatic enzymes, biliary bile acid, we talked about all that. Small intestine, the enzymes, the sugar absorption, and fermentation. Okay, now there's a diet out there now that's a big fad thing, and it's called the Fodmap Diet. The only thing about the Fodmap Diet is they still allow sugar in that diet. I'm going to tell you that fermentation in the long run, when you think of sauerkraut and things like that, there's sodium in sauerkraut. There's sugar in pickles, some of the pickled items. So you have to be very wise about where you are with this fermentation, because if you think about making dough with yeast and you put your yeast in, they use a little bit of sugar and they put some warm water and you put it in your flour and you're making this big bowl of yeast. My mother used to do this for pizza parties. And then it just grows and grows and grows. Imagine that in your gut. Okay, so it's just growing. This is just populating and you're feeding it sugar and it just keeps growing and that yeast builds up and it causes a lot of gas. So, okay, so now let's go back to some other issues. I'm not going to go through all this. Gastroparesis, we talked about that. Transit time modulators. Okay, so he's talking about ginger and some probiotics, D-limonene. Okay, I'm not going to get into this. There are Chinese herbs, I believe, that are very helpful. And I don't want to get into everything because, like I said, I do not have, I did not talk to him directly to share this information, but he did an excellent job. So we're going to stop there. And that is, and go back to what I have to offer here. First of all, I want to thank you for joining me tonight. The other thing is, I hope that you learned a little bit about your gallbladder and what's going on and digestion, because it all starts in the mouth and the teeth. Now, I have had issues with my teeth my entire life. And I had a lot of problems when I was in nursing, and I worked a lot of night shifts and I was eating out of the vending machines at night. And then in the nurse's station, we would get boxes of candy and that was like my go-to thing. crackers and applesauce, and it was all carbs. So sometimes we're surrounded by all these carbohydrates. People love, I loved pierogies, even I loved ravioli and pierogies. So these are all carbohydrates. And when you're surrounded with them, they just cause so much distress. And I hope that you'll want to take action with some better tools. So tonight I made a few things. Because I love making little salads in these jars, I made one up tonight that I thought I'd share with you. This little salad is in a jar with a little handle, and I thought for kids this is really fun, but this could be fun for anything. So I put the hummus at the bottom, and then actually I put blueberries in here. So I already included some fruit in this one. And then I put, these are peppers. You can use carrots, peppers, whatever you want. You can use beans instead of your hummus, but I thought that that'd be fun at the bottom just to mix it up. And then I have pistachios in here with some sunflower seeds. I use 2 different types of seeds, and it's always good to mix things up. You don't want to eat the same salad all the time. You want to mix things up. So you might have 2 of these salads in your fridge with 2 other salads that you can alternate, okay? I put cauliflower and broccoli, and then there was a mix of a broccoli flour, it was a superfood mix that I put in there, and then I put my lettuce on top. I also put red onions in here. I would, for your salads, use just a little bit of different onion for each one. And the thought for me is just season it very lightly, either with salt and pepper, or you can get a special everything seasoning or whatever you have, just put a little bit of it on there. And then my favorite is to either use an olive oil, because you want good fats in your salads. And these fats will help you with brain function, with clarity, and will help you with energy all day long. So I love this brand. Okay, now these are citrus. They do have citrus in them. So just keep that in mind, because you don't want to do over citrus your foods, and that'll change your pH too. You want to use a little bit at a time, but just drizzle on this salad. I want to tell you, it turns it into a whole different ballgame. And then you can either add olives, like a few olives in there, or if you don't have olives, then you can add olive oil instead if you don't have these other flavored olive oils. So this, I think, is a fun idea. You can actually have a little party for kids to create their own salads, and then cut things up into a big, have little dishes where you can have different items in there for them. And that would be something fun for them to create on their own. They can make their own little salad bar. And then they can help determine what they want to do. Now, I made something out of there's only 3 things in here. This is coconut cream, mango, and bananas. Now I used 3 bananas per one mango, and I put it in a little ramekin. You can serve it however you want. You can freeze it, or you can serve it as it is. And I just put it in the food processor and put it on low process for about 5 to 10 minutes. And so that mango with the banana and this, and then I topped it with, so what I have here, I don't know if you can see that. I'll show you the toppings, because this is another fun item for kids. You can top it with this mixture is cocoa with beet powder. That's cocoa and beet powder. So I sprinkled some of that on top of there. Then I sprinkled some of the mint, fresh cut mint, and then some raspberries. And I want to tell you, I had some of this and I love it. So I hope that you will enjoy it as well. I'll write the recipe out and have it for you down below. I hope you'll subscribe to my channel. I hope you enjoyed tonight, that you learned something about digestion, and that these little ideas can help you, because getting prepared with your food, having it in the refrigerator. I did one whole episode on food preparation, and having something in the freezer. Even if you freeze all of your proteins, like your meat proteins, your turkey and chicken, stuff like that, freeze that, and then make up new brown rice or quinoa or whatever you're doing, have that in the refrigerator at the beginning of the week, and then have your other items, your fruits and vegetables. You can either cook them on Sunday or Thursday, whatever days are available to you, or you can, do things fresh, just right out of the refrigerator. I like to get them prepared for Sunday, but there are some weeks where things come up and it changes your schedule a little bit. So you got to just try to work with it. Stick with 1 or 2 days a week that you're prepping, and to get things better so that you can be on target. I'd love to hear what works for you. Please post below, subscribe again, like I said, to my channel, ring the bell, and then let me know how I can help you. If there's any other questions, if you want to know what worked for me, because it's not just all about eating, but eating is a major role in reducing. If you're dealing with pancreatitis, you are in a very unstable place. And if you don't go slow with what you're doing, you can really get sick and it can go down the wrong road. So it's about introducing very slowly. Sometimes it's pre-cooked food because your enzymes aren't working, and making sure that you just do things. Sometimes it's just broth, vegetable broth. You're starting off very slow, getting the body back to healing. It's got to heal everything. It's got to heal. Blessings to you. Thank you for joining me. Diane Greco-Allen, food relationship coach. Come back and visit.